Hello friends, today we will discuss the issues related to elderly. This is part of paper 2 general studies. In general studies paper 2, you have one section, mechanisms, institutions for the vulnerable sections. Okay, so in that elderly can be there. So and in fact in recent days we have seen questions related to elderly and it is always there in the national and social discourse. So it's a very important topic. So we'll take that up today. Now before going into that, I'll just give you a brief overview of things that we are going to cover in this entire session. So first we will start with some facts. For example, how to define who is an elderly, who is considered as a senior citizen, what is the number of elderly population in the country. And again, there are a lot of variations across states, so we'll discuss that. Also across gender, some variations are there. We'll take that up. Then we will look at some issues, some specific issues that the elderly section faces. For example, they might not have access to finances, economic insecurity, or they might have problems when it comes to housing, or they might have problems, for example, they might be isolated in the society. So some sort of specific issues related to elderly we'll discuss. Then to address these issues, we have different constitutional provisions, we have different legal provisions. We'll take that up one by one. And apart from that, we have also drafted policies from time to time. For example, we have had national policy for older persons. It was drafted in 1999. Then we have also appointed a committee, the Mohini committee, to look into the specific issues related to elderly. So we'll discuss that as well. Apart from all these policies, committee reports, we'll also take up some schemes for the elderly. In recent times also, you might have come across these schemes, for example, Atal Pension Yojana. So we'll discuss briefly about these schemes. One more thing related to elderly, some important trends. Okay. What are some important trends related to elderly? On one side, we say we are having demographic dividend, but at another side, we are also having an aging population. Okay. So what do we mean by aging population? What are the repercussions, and how do we address the challenges posed by an aging population? So that we'll discuss. And one very important trend is feminization of elderly. We'll also take it up. Apart from that, we will also look at some solutions. What needs to be done to improve the condition of elderly in the society? So this is going to be the brief overview of things that we are going to cover in next few minutes. So the definition of elderly. Now, is there any uniform definition for elderly? Do we have any universal definition for elderly? So at present, there is no uniform definition. So there are different laws. For example, Maintenance of Parents and Senior Citizens Act, that is also referred to as the Senior Citizen Act. It defines someone as elderly who is greater than 60 years of age. Then we have another policy, national policy for older person. According to that, anyone above the age of 60 is elderly. But also there are some schemes, for example, Annapurna scheme is there. According to that, the beneficiary should be greater than 65 years of age to avail the benefits. So we do not have any uniform scheme as such or uniform policy for addressing elderly. So now the first question arises is, who is a senior citizen? Who can be considered as elderly? Do we have any uniform definition for that? Do we have any universal definition for that? The definition which can be applied everywhere? So as of now, we do not have any such definition for elderly. So there is no minimum criteria. But again, we have different laws, we have some policies, and we also have some schemes. So for example, there is a Senior Citizen Act. According to that, anyone who is above the age of 60 is considered to be a senior citizen. Then we have a national policy for older person. According to that, anyone above the age of 60 is considered to be an older person. But again, we also have a scheme, which is the Annapurna scheme. According to that, anyone above the age of 65 gets the benefits of those schemes. So as such, we do not have any uniform definition who is elderly. Now, next part, what are some important numbers, facts related to elderly? So it has been observed that the elderly population has increased significantly over time. For example, in 2001, the elderly population was 77 million and it increased to 104 million in 2011. So these are the census data. And the United Nations Population Fund, it has estimated that elderly population in India will increase 3 times to 300 million by 2050. And not only is the population increasing, but also the proportion of elderly in our population, that is also increasing significantly. And it is estimated that the proportion of population in elderly will increase to 19%. At present, it is 8%. So 8% to 19% increase in proportion of elderly. So at present, if there are 100 people in our society, 8 to 9 are elderly. In future, in 2050, out of those 100 people, 19 will be elderly. And again, this is in continuation. This is a trend. In 1961, this elderly population was 5.6% of the entire population. It has increased to 8.6 now, and in future, it will become 19%. So you can observe one thing, that this increase is very drastic. In 50 years, it increased by just 3.6%. But in the next 40 odd years, this is increasing by almost 10%. Okay. So, and because of this, there will be a lot of repercussions on the society, a lot of consequences on the society. We need to take that into consideration. We'll discuss that in detail after a few slides. Now, some more facts related to elderly. It has been observed that the sex ratio among elderly is favorable towards women. So, among the elderly, you will find more women. In case of India, as per the 2011 census, 1,033 females are there for every 1,000 males. And one more thing here, this is not something specific to India. World over, among the elderly population, you will find more females. So a question might arise in your mind, why is it so? Why more women in the elderly population when in the entire society the sex ratio is generally favorable towards men? So we will discuss this in a while. But just keep this in mind that more elderly women are there as compared to elderly male. And again, one more thing you can also think of, or one more thing also you can keep in mind, as the age increases, the proportion of elderly women also increases. For example, in the age category 80 plus, you will find even more elderly women as compared to in the age category 60 plus. Some more facts, the life expectancy rate, the life expectancy at birth is more for females as compared to males. So this basically follows from this thing, from the sex ratio. And again, the proportion of elderly in the population, it is not uniform throughout the country. It varies from state to state. For example, state like Kerala, it has around 12% of their population as elderly. A union territory like Dadra and Nagar Haveli has just 4% elderly population. What do you think can be the reason for this? Why is it so? One state has 12%, while another union territory is having just 4%. Again, one reason for this is high levels of healthcare. So if the healthcare system, healthcare apparatus is very good, then life expectancy will be very high. So and you can observe it here as well. The Kerala has the highest life expectancy at birth. So 71.8 years for males and 77.8 years for females. And also one more thing, why some states have a high proportion of elderly, it might also be because of low fertility rates. If the number of children born are low, so the youth population in future will also be less. So the proportion of elderly will be high. So two reasons why there are variations. Maybe one, maybe because of the very good healthcare apparatus, and second because of low fertility rates. So population growth is going down. At the same time, the proportion of elderly in the population is increasing. Okay. So these are some key facts related to elderly. Now, next part, United Nations has certain principles for older persons. These principles came into being in 1991. And what is the reason why they have these principles? It is assumed that states, when they are drafting their laws, they should consider these principles. Society also should take into consideration these principles. Okay. Now, what are these principles? So the first principle, it says that elderly should have independence. That means they do not have to depend on someone else for their basic requirements, for their food requirements, for their shelter requirements. So they should be capable themselves. That means they should have some income as well. So they should be part of some income generating activities as well. Now, the next principle that United Nations principle of older person tells about is participation. Elderly people should be able to participate in the social processes. Okay. They should be able to participate in the social process. What do we mean by social process? For example, cultural processes, political processes. They are effective part of the society. They should not be ignored. They should not be neglected. They should not be isolated. And also one more thing here, when we say participation, it also means that they should be, or they should also be the participant in the process by which you are making policies. So whenever there is any policy intervention or when you are to draft a policy, you should also take the opinion of the elderly person. That can make or that can help you formulate better policies. Okay? So participation in policy formulation as well. Now, next principle that this talks about is elderly people should have access to basic healthcare, and they should also have access to optimum level of healthcare, which will ensure their physical, mental, as well as emotional well-being. Now, next principle is self-fulfillment. That means elderly people should be able to fulfill their potential, whatever potential they have. They should be able to fulfill that. And last part is they should be able to live a life of dignity. That means they should have some sort of security. They should not, or their basic rights requirements should be fulfilled, and they should be provided some sort of security. Okay? So dignity. So this is United Nations principle on older person, and the state or the society, whichever is trying to improve the condition of elderly, should take all these things into consideration. Now, what are some of the problems faced by the elderly population? Now, one very key issue here is income insecurity. See, it is said that 50% of our elder population have some sort of income generating activities, but the amount of income that they get is very low. So they are not able to sustain themselves. That is the reason they have to depend on someone else. And it is said that around 75% of our elderly are dependent on others for their day-to-day requirements. And also among these people, you will find a higher frequency of female. So more female elderly are dependent as compared to male elderly. Now, next thing, many of them have lost their spouses. So they lack different kind of family support structures. And also, if you observe in our society, the informal and the family structures are also disappearing at a very fast rate. For example, we are moving towards nuclearization. Our society is becoming more nuclear. We are moving away from extended families, joint families. So in that case also, elderly remain isolated. And because they remain isolated, they can suffer from different mental health issues. And it is one of the reports pointed out that 10% of the elderly suffer from depression. And around 40-50% of them require different kind of psychiatric intervention. Now, next issue is with morbidity. Elderly face a lot of morbidity, different kind of health issues. Many of them face different chronic ailments. For example, hypertension, diabetes, arthritis. And the problem with these kind of diseases, these are non-communicable diseases, and they remain throughout your life. So because of that, you have to spend a lot of money. And the cost of these, cost of curing these ailments, or cost of managing, if you cannot cure it, you have to manage these kind of ailments, is very high, and you have to do it throughout your life. So it becomes problematic, and it leads to a very high out-of-pocket expenditure for the elderly. And one of the consequences of these high levels of morbidity is also disability. So morbidity can sometimes lead to disability. And if you look at the disabled population, a very high percentage of disabled are from the elderly sections. In case of India, if you look at the entire population, for every 1,000 people, you have 22.1 people who have some sort of disability. But if you look at the elderly population, this ratio is 51.8. And if you look at the elderly population above the age of 80, this ratio is even higher. So 22.1 for regular general population. Those who are greater than the age of 60, it is 51.8. And those who are greater than the age of 80, it is 84.1. So among the disabled population also, the proportion of elderly is very high. And because of disability, again, dependence increases. Their health costs also increases. So it creates a lot of issues. Then there is one report, Health Age India study. It says that 50% of the elderly population face some sort of abuse. And women face more abuse than the men population. Last part, among the elderly, there is lack of awareness about the different schemes and policies. Though we are having multiple schemes, policies, many of them are not aware of it. One of the reasons can be because of lack of access to education, literacy rates might be low. And again, a large proportion of this elderly population is female. Already female have less access to information. So all these things increase the problems that elderly face. So this is about problems of elderly. The income insecurity they face, the lack of informal and formal family structures, prevalence of morbidity, different kind of diseases, especially non-communicable diseases, and which leads to disability in the long term. Presence of elder abuse in the society. 50% of our elderly face some sort of abuse. And apart from that, lack of awareness among the elderly about their rights, about different kind of schemes, policies. Now, to address some of these challenges that elderly face, we have some constitutional provisions, we have some legal mechanisms. So we will discuss these constitutional mechanisms and legal provisions one by one. So the constitutional provisions related to elderly. So we have some directive principles which take the issues of elderly into consideration and which try to improve the situation. For example, Article 41. It calls for providing public assistance for the old. Then we have Article 47. It calls for providing nutritional support for those who cannot afford it. So in that case, elderly will be there. Then also, this taking care of the elderly, this responsibility lies with both the state as well as the union government. That is the reason some of the provisions related to elderly is there in the state list as well as the contract list. For example, item number 9 in the state list, it says that state can make provisions to provide relief for those who are disabled or unemployable. So again, among elderly, the unemployment is a huge issue. So through this particular mechanism, elderly can be provided some sort of intervention. Apart from that, some items in the list, contract list, for example, item number 20, 23, 24, they also talk about issues like or provisions like economic, social planning, social security, social insurance, and old age pension. These things can also be taken up by both the union as well as the state government since it is in the contract list. Now we will look at some legal mechanisms for the elderly. So what is the legal mechanism present to ensure that elderly have access to some basic amenities? Now there is one provision, Maintenance and Welfare of Parents and Senior Citizen Act. This act came into being in 2007. Now what is the meaning of this act? Just look at the terms, Maintenance and Welfare of Parents and Senior Citizen. So here it is talking about parents, at the same time it is also talking about senior citizens. So those who might not have children, those senior citizens, they are also covered under this. Now what are some of the provisions under this? So according to this law, it is the duty of the children to take care of their parents. So it is a legal obligation on the part of the children or the heirs to ensure the maintenance of the senior citizen. Now what is the meaning of this? In case the parents are not able to meet their basic expenditures, so they can approach a maintenance tribunal. So what will this maintenance tribunal do? Maintenance tribunal will decide how much maintenance these parents require, and it can ask the children to provide for the same. So the state has to create all these tribunals. These tribunals will be at the level of the subdivisions. And again, in case there is some sort of conflict related to that, so appellate tribunals will also be constituted. And the appellate tribunals the state will constitute at the district level. Apart from constituting these appellate tribunals as well as maintenance tribunal, the state can also construct different kind of old age homes in every district. So this is not a mandatory provision. The state can do that as per this law. But one thing you note, it also talks about senior citizens, not just parents. So in case someone is not having a child, in that case, what is the scenario? So in this case, the heirs of that person, those who are going to inherit the property, or those who are maintaining the property, they have to take care of the senior citizens. So it defines who are the relatives, and relatives are the ones who have to provide maintenance. So even if a senior citizen is childless, they also get some sort of maintenance. And then one more thing you know, how these maintenance tribunals operate. So here, lawyers are not allowed to work, or they are not allowed to enter into the proceedings directly. The members of the tribunal and the parents, they will directly interact, and also the children. And here, these tribunals can decide on the maintenance. They can, for example, they can give a maintenance till 10,000 rupees. The maintenance cannot be more than 10,000 rupees. It can be less than that, but not more than 10,000. And again, this can be changed from time to time. It is not uniform. So let's say they have given 5,000 rupees now, but in case in future it is felt that more amount has to be given, so it can be changed. And also there is a provision for interim maintenance. That means some immediate requirement is there, the proceedings have not completed, so interim maintenance can also be provided. And in case the parents complain that their children are not supporting them even after the ruling, then again there is a provision by which the children can be penalized. Children of the heir can be penalized. They will be fined some 5,000 rupees or 3 months of imprisonment or both. So these are some provisions. So key thing you should note here is it is the duty of the children and the heirs to take care of their parents or take care of the senior citizens, and it is a legal obligation. As per the law, it becomes a mandatory obligation. Okay. So keep this in mind, and state can create old age homes, and but state has to institutionalize maintenance tribunals as well as appellate tribunals. Okay. Now, next policy we discuss is the policy on older persons. Now, what is this policy? So apart from the constitutional and the legal mechanism that we have, apart from the right to principles and the statutory provision, Senior Citizen Act, we also have a national policy for older person. This policy was drafted in 1999. It looks at multiple dimensions. For example, the financial security dimension. It looks at the healthcare requirements for elderly. It looks at the shelter issues of elderly. It also focuses on the welfare needs. And apart from that, it says that some basic facilities need to be provided to the elderly. So now, when it comes to income security or financial security, what does it say? It says that we should provide them some basic earnings, some basic pension should be there for the elderly. And in recent times, what is there? We already have an Indira Gandhi National Old Age Pension Scheme. Then it is saying we need to provide them tax exemption, which is provided to them. Apart from that, if someone is investing in the requirements or for the healthcare needs of the elderly, they also should be provided some sort of tax benefits. Apart from that, elderly should have preferential access to public distribution systems. Apart from these financial aspect, one more key issue that elderly faces: access to healthcare. Elderly face different health ailments, and one of the prominent health issues they face is chronic ailments, non-communicable diseases. And because of that, the expenditure on healthcare needs is very high. Out-of-pocket expenditure increases significantly. So they are saying we need to improve public healthcare services so that these kind of facilities can be availed at the government institution itself. And not only just the physical health services, we also need to improve mental health services. Why? One of the implications of isolation, or one of the implications of decreasing informal and formal support structure is increasing depression-related issues, mental health issues, because of which elderly need different kinds of psychiatric interventions, and that can only be provided in these institutions, the counseling facilities. So we need to improve on that. We need to increase on that. Apart from this, if someone is setting up institutions, for example, R&D in geriatrics, R&D in healthcare requirements for the elderly, we should incentivize that. We should provide some sort of subsidy. We should provide land grants, tax reliefs. So these should be provided. So private sector participation of civil society in these areas can be increased through this. Now, next dimension they're talking about is shelter. Elderly might not have access to shelter, or they might have to be dependent on someone for shelter. So what they're saying, you have to increase access of elderly to shelter facilities. So one way is you should have more housing policies which address the needs of the elderly, affordable quality housing. And even if the policy is addressed towards everyone, certain allocation or certain outlay can be there for elderly. Apart from that, if you're constructing housing societies, you need to take into consideration the specific requirements for elderly. For example, it might not be easy to access. So we need to provide all the mobility support so that they can access each and every part of those colonies of those societies. And one more thing, in case there is any land dispute involving elderly, you should try to resolve that in a fast-track manner. A quick disposal of cases. Now, next dimension, the welfare dimension. So here again, elderly is not a homogeneous group. Among elderly also, different groups are there. For example, some of them might be more deprived. Those who are above the age of 80, they face more disability. That is what I told you some time back. Apart from that, females among elderly might face more deprivation because of the kind of society we are, because of the literacy levels among them, because of their level of participation rate. So elderly is not a homogeneous group. Some elements or some sections among elderly might be more deprived. So again, we have to target all these sections differently. We need to have different approaches. Okay. So and for that, we need to also have some funds. So we need to create some central welfare fund, which we have created later on. This policy came in 1999. Many of the things have already been taken up. Apart from this, some basic facilities need to be there. For example, in public transport, there you can provide some fare concession, or the public transportation should be such that it is easily accessible to the elderly. Also, you can have reservation for seats. So these are certain dimensions on which this national policy for elderly person is talking about. So financial security, healthcare requirements, shelter, welfare, and provision of some basic amenities. Now, this was drafted in 1999. So 10 years after this, a committee was set up to review this particular policy. And again, they are also giving some suggestions. And they have some, whatever suggestions they are giving, it had been incorporated in the draft national policy on senior citizens. Now, what this particular committee is saying, what this Mohinigiri committee talks about, the Mohinigiri committee. Now, they are saying some elderly people, they have got us different national laurels. They have increased our reputation at the international level. So these elderly people should be provided some additional benefits. For example, lifelong healthcare. So this is one suggestion of the Mohinigiri committee. Apart from that, they feel that when it comes to the issues of the elderly, we need to have some institutions whose function will be to just handle the issue of elderly. That way, elderly will get the desired focus. So they're saying we should have some department of senior citizen, or we can have a national council for senior citizens. So all the efforts of these institutions will be for elderly. And given the future trend, we're having an aging population. 90% of our population will be elderly. So these kind of institutions will be very important. Apart from this, they're saying we need to reduce their dependence on others. So we need to find out alternate mechanisms by which we can give them livelihood. So we need to create more income generating activities. And another dimension here, right now we have pension schemes, but at the time of when this committee was formed, when they had given this report, then also they had a pension scheme, the Indira Gandhi National Old Age Pension Scheme. But the amount of pension that is given is very less, and it is also limited to only the below poverty line category. So what they're saying is this kind of pension scheme might not be very helpful. So they are saying we should expand it. We should expand it to all elderly population, and also this monthly pension it needs to increase. So to give you a perspective, right now the total amount of pension that is given is 500 rupees. That too for someone who is greater than 80 years of age, and those who are below 80 but greater than 60, it is 300 rupees. So the amount of pension is very less. You can't do much with this amount of money. So these were some of the recommendations of the VV Mohinigiri committee. Now apart from this, different states have also had their own policy interventions. So you can also think about your own state. Just find out in case they have done something about it. And many times in the local newspaper also you get to know about this. So here just I'm taking one draft policy. This is the policy of Maharashtra. Maharashtra came up with a policy for elderly in 2013. So according to this policy, what they're doing, they are setting up a separate institution, a separate commissionerate for elderly population. So if you're having a separate commissionerate, so it will just be focusing on elderly issues, so their issues will not get ignored. They will not be isolated from the mainstream. Apart from that, what they're saying, every year they will create a report. A report has to be presented about the status of elderly. So in case you're not doing anything, what do you write in the report? So this report is an accountability measure. Apart from this, what they're doing in the state public transport buses, they're giving some sort of concession, some discounts are provided to elderly. One thing I told you, Helpage India report 2015, it said that 50% of the elderly population suffer from some sort of abuse, and generally there is not much awareness about it. So what this Maharashtra policy is trying to do, they are saying one day in a year they will observe as elder abuse awareness day. So June 15th they do that. So again this spreads awareness related to the different grievances that elderly have, different exploitation they face. So it is a very good advocacy mechanism. Now they are also trying to improve the access of senior citizens to different institutions. So they are providing wheelchairs at public spaces. And apart from this, if any other organization or institution wants to have some event for the elderly, then government will provide them rental space for free. And apart from this, they are also setting up a gerontology department in JJ Hospital. JJ Hospital is one of the prominent hospitals in Mumbai, and gerontology means study of issues that impact elderly. So genetics is the field of study. Gerontology, genetics, these are some of the words which you come across when you discuss elderly. Keep this in mind. So this is one state policy. You can also think of other state policies. Your own state might have some policy related to that. Now, apart from the policies, the national policy of older person, the Mohinigiri committee report, and the state policies, we also have some schemes which target different needs of the elderly population. For example, we have in Gandhi National Old Age Pension Scheme. It is under National Social Assistance Plan. So under National Social Assistance Plan, different vulnerable groups are covered. They are provided some monthly benefits. So this old age pension scheme falls under that. So according to this, those who are in the below poverty line category, they get 300 rupees per month. They should have it at the age of 60. And again, if the age is above 80 years, then they get 500 rupees per month. Now, in case someone is not covered under Indira Gandhi National Old Age Pension Scheme, they can be covered under Annapurna Scheme. But one thing you should know, if you are getting benefits under Annapurna Scheme, you should not get benefit from the Old Age Pension Scheme. You can only avail one of these facilities. And under Annapurna Scheme, another clause is there. It is applicable to those only over the age of 65 years. And under this scheme, you get 10 kg of food grain. Now, next scheme is Atal Pension Yojana. So in this case, what happens? Those who are in the unorganized sector, in the age category 18 to 40 years, they can join, and they have to contribute every month to a corpus. And when they are retiring after the age of 60, they will get some amount of pension every month. So this amount of pension depends how much they have contributed over their lifetime. So this is Atal Pension Yojana, and you should keep in mind that this is for unorganized sector. Another pension scheme is Pradhan Mantri Vaya Vandana Yojana. In this case, you have to contribute, and when only after the age of 60 you have entered into the scheme, you have to pay one lump sum amount, and after that, for the next 10 years, you will get some pension every month. And also during this time, you will also be covered. Your life is also covered. In case something happens to you, again you will be covered under insurance. So insurance and pension both is happening here. This is implemented by Life Insurance Corporation of India, but the amount of return is very high. So 8% per annum interest is provided. That is subsidized by the central government. Apart from this, the central government has also institutionalized Senior Citizens Welfare Fund. So in case there are some other institutions which were supposed to allocate certain amount of money for the needs of the senior citizens, they could not do it, or it was unallocated. They did not use it. So in that case, it has to be diverted to the Senior Citizens Welfare Fund. And what this fund will do, it will utilize this money, the money of the fund, for different schemes for the senior citizens. So at present, these are some of the schemes related to elderly. Many times in news we come across these schemes. Okay? So whenever we come across these schemes, just think about this, why they have provided all these things. Now, we will discuss two very important trends related to elderly. And these trends can be asked in your exam. Already they have asked these kind of questions in sociology paper as well. And these kind of things are quite frequent in the news. And last year there was one aging report, 2017 India Aging Report, United Nations Population Fund. They had also talked about this. So this is important, keep this in mind. Now, you can see a graph on the screen. This shows the percentage of elderly population. So as you can note, the percentage of elderly population was somewhere around 5%, 6% in the beginning, in 1950, and it is increasing drastically. So somewhere in 2050, it will be somewhere around 19%. And at present it is somewhere around 8 to 9%. So the percentage of elderly is increasing. So that will lead to increase in old age dependency ratio. Now, what is old age dependency ratio and why should we know about it? Old age dependency ratio means the number of persons who are in the age category 60 or more by the number of people who are in the age category 15 to 59. That implies 15 to 59 age category, they are the ones who are working. Well, greater than 60, let's assume that they might not be working, they are not working. So they are dependent on someone else. So they are dependent on the working age population. So it is being said that our old age dependency ratio will increase. As you can already note, it was 10.9% in 1961, it has increased to 14.2%. This will further increase. Why it is going to increase? Two reasons. One is the numerator, the percentage of elderly population is going to increase, which I showed you in the graph. And at the same time, this denominator will also decrease. Why this denominator will decrease? Because the people entering into this age category will decrease in the future. Why? Because our fertility rates are also going down. At present, the fertility rate is 2.4. Our aim is to take it to 2.1. At one point of time, during the 1950s, the fertility rate was 6. So from 6 to 2.4 we have achieved, and our aim is to achieve 2.1. Some states have already achieved that. So fertility rate, that means number of children a female is producing, that will go down. If the number of birth is decreasing, those who are entering into this section 15 to 59 age category, that will also decrease. So the numerator is increasing, the denominator is decreasing. So what is the result? The old age dependency ratio will increase significantly. Now, what will be the consequence of the drastic increase in old age dependency ratio? So just look at it. Percentage of elderly is increasing. So they require income, they require different type of security, for example, health security, food security, which has to be met by the state. State has to provide some sort of assistance. So how does state provide the assistance? From the tax. From whom do we get the tax? From this section, the working age population. Now, the requirement for security is increasing, but the amount of money that we can raise by tax can decrease because the people who are in that taxable bracket is going down. So as a consequence of which, we will have a lot of pressure on the working age population. So the productive part of the population, they will be overburdened. And it can have direct consequences on the financial expenditure on social security. So this is a very important trend. And again, how do we address this? That can be asked in your exam. So we'll see some of the measures how we can take care of this, but you should know this, that why this change is taking place. Increase in life expectancy and decrease in fertility rate. This is leading to this kind of trend, and this kind of trend can be problematic to handle if you are not doing, or if you are not starting thinking about it from now onward. See, another very important trend that we observe among the elderly population is feminization of elderly population. Now, I had already told you about this, that among the elderly population, you will find more females. For example, the sex ratio in India, for those who are above the age category 60 years, you will find more females, 1,033 females for 1,000 males. And this is not something unique about India, it is universally found. So every country, more or less, is the same thing. So the question that you might think about is, why is it like this? Because in the entire population, you will find more males, but why among elderly, you have more females? So here, different studies are there. Scientists, economists, they are all trying to find out the correlation. But again, there is no conclusive evidence as of now, but there are multiple correlations. So some theory, so especially the biological theories, evolutionary theories, they say maybe there is some biological evidence, maybe women are more biologically advanced. And that is the reason the mortality rate is less, that is the reason the life expectancy is more. So one reason they say is, women, they have two X chromosomes, while men have X and Y chromosomes. So in case there is any mutation in the X chromosome, they have the chromosome. So it helps them. Then there are some other theories. For example, there was a study on mortality rates. Okay? So they are finding that if you look at accidents, more men are prone, or men are more likely to die of accidents than women. Then they are studying alcoholism again, and drug abuse also. They also, men are more likely to be involved in these activities, in alcoholism as well as drug abuse. They also studied violence. So those who were in the age category 30 years, men and women, they were studied, and they found that the number of men involved in violence was 4 times more than that of women. So all these things might be the reason why you will find more women among the elderly population. Again, this is not conclusive. Correlations are there. Right now, we cannot conclude. So this can be the reason. And one thing you will find is, as the age increases, the number of, or the ratio between women and men, that also increases. So more women as the age increases further. Now, what kind of issues it results in? See, already the outlook towards women is not that good in the society. We are a patriarchal society, and widows are looked, or there is some social stigma associated with widows. And already the condition of women is not good. Generally, when it comes to literacy rate, you will find literacy rate among females worse than males. And also when it comes to labor force participation rate, women lag behind. And all these things results in a scenario where women do not have access to different kind of legal mechanisms. They're not aware. Even if some schemes and policies are there, even if they have the right, they don't know how to exercise that. So because of all these things, they lack when it comes to resources, they lack when it comes to access to basic services. Many times they are exploited and abused, and gender-based violence continues, or is always perpetuated. And many women, even though they should have the rightful owner of assets, they are not owning it. And one more consequence of feminization is women face a lot of isolation in the society. Just think about it. Why women face isolation? See, the life expectancy among women is more than that of men. So we saw some slides back, some moments back. For example, in case of, let's say, in the state of Kerala, life expectancy was 77.8 and 71.8. Okay, so 6 years more the female survives as compared to their male counterparts. But also one thing you should keep in mind that when they have married, generally the male would be older than the female. So in case their age difference was 3 years, now the period of isolation becomes 6 plus 3, 9 years. So because age at marriage is different among them, and because the life expectancy rate are different for both of them, the period of isolation increases significantly. And all the issues that we see over here, it gets even more aggravated. So this is a very important trend. Whenever there is a question related to trend in elderly population, you should look at both the things, old age dependency ratio as well as feminization of elderly. Till now, we had discussed what are some of the problems and trends related to elderly population. Now we will look at some suggestions how we can improve the condition of elderly. We saw that the old age dependency ratio is going to increase with time. That means the elderly proportion of population will increase while the tax base who contribute to the income, who contribute to taxes, who contribute to the social security mechanism, that is increasing. So how do we address this thing? So one way is we should have specific social economic policies to address that. What sort of policies? We need to promote pension policies, we need to promote health insurance policies. Now what will these pension policies do? These pension policies will ensure that people who are young now, they contribute for their retirement planning. So when they are old, when they are not able to find a job, or when they are not able to work, they have a stable source of income. Apart from that, elderly face different health issues, the requirement, the healthcare requirement will increase in the future, so that can be taken care by different health insurance mechanisms. We need to promote that. One issue generally we see is we have policies, but policies are sometimes not relevant. So we have to ensure that these policies are in place and also they are relevant. So what can we do about it? We need to include elderly in the policy formulation process as well as in the implementation process. So we need to take regular feedback from them. We need to have regular policy audit. This can ensure that these policies remain effective. Now, one important thing here is we need to promote the concept of healthy aging. Aging may not be a painful process. Aging may not be a very sad process. Aging can also be a beautiful process. We need to promote that. How can we do that? There has to be advocacy campaigns. Mass media can play a very important role. Social media can play a very important role. Social media, mass media can raise awareness about the problems of elderly. How it can be addressed. At the same time, we need to promote different healthy practices, for example, exercise, yoga, all these things that can also improve the conditions of elderly. They might not face different health issues which they are facing right now, or at least we can decrease the prevalence of these things. Next thing, we need to have better medical facilities. Public access, public health institutions, public access to these institutions need to improve. We need to have more research and development in geriatrics. Elderly, they have some special health issues, and also these non-communicable diseases. Among elderly, it is very high. We need to focus on all these things. And here again, we need to focus on capacity building of our personnel. We need to have doctors specializing in geriatrics. We need to have health workers. We need to have nurses who are specializing in all these things. So that is also a focus area. In recent times, there has been a positive development in this. There are two national centers of aging. For that, the government had signed an MOU. One will be set up in Delhi, another will be set up in Chennai. So what they will do, they will create specialized cadre of professionals who will look into the healthcare needs of elderly. They will also draft different manuals. They will have the standard operating procedures. For example, many times elderly, they are not admitted in healthcare institutions. They might be staying within the house, but they require some specific treatment, some specific care. So again, these manuals will have that. Apart from that, they will also have cutting-edge research in the issues that elderly face. And apart from this, they will also have 200 bedded facility each. So we need to have better medical facilities. Now, community should be involved in the entire process. So community, so again here we need to create an environment which is safe, which is secure for the elderly. We need to have advocacy campaigns. So which will clear, which will take care of the cultural lag, whatever issues are there between the elderly and the younger generations. Now, apart from this, we need to find out avenues or find out ways by which we can improve the infrastructural requirements for the elderly. We need to have more old age shelters, or we need to promote all these things. For example, state like Florida, US, they're promoting it that way. And in India also we can take up those kind of things. And again, how do we raise revenue for that? We need to find different financial mechanisms. For example, one way of doing it is to PPP models. We need to create institutions, for example, healthcare institutions. We need to create old age shelters, old age homes, rehabilitation setups. So all these things we need to find out different ways of financing. This can be taken care by this. Apart from that, as I discussed before as well, elderly, they are not a homogeneous group. Among them also different, some are more vulnerable, some are less vulnerable. So those who are more vulnerable, we need to have targeted approaches to provide them specialized attention. So we need to focus on that as well. So these are some of the suggestions that we can consider when we are trying to address the healthcare needs of the elderly. So to sum up, we should know about some of the numbers related to elderly, their proportion in the population and how it is changing over time. And again, in this population also some of them are more vulnerable. Now again, what makes elderly vulnerable? What are some of the issues they are facing? Now next part, what are some of the principles of elderly? What are some of the constitutional principles of elderly? What are some of the statutory principles for elderly? Some of the policies within India, national policy, monetary community policy, and also some state policies, and some recent trends related to elderly. So aging of our population, which will lead to a higher old age dependency ratio and feminization of elderly. And how do we address the challenges that elderly will face? So this is the entire topic related to elderly, a very important part under vulnerable sections of GS2. And here again, what kind of questions you should be expecting? Most important thing is they will ask you the trend, what kind of trend you are expecting, and how do you address that? What should be the policy challenge here? What can be some of the policy gaps here? So you need to focus on that. And feminization of elderly is also important. And this feminization of elderly can be asked in general studies paper 1 as well, because women, one component of GS1 is also role of women in women organizations. So in that also they can indirectly ask, or one of the features, salient features of Indian society. In that also they can be asked. So these topics are important for paper 1 as well as paper 2. Keep this in mind. And again, when you are referring to different sources, I would suggest one very good source for this is the aging report that has come up, that has been drafted by the United Nations Population Fund. You can go through that. It talks about these trends that we discussed, many of these trends, and it also talks about some policy interventions. You can refer to that as well. Apart from that, the things that we covered more than enough to handle whatever issues or whatever questions you should be expecting in your main exam. Thank you.